Hi, my name is Dr. Aqsa Shaikh and I'm Associate Professor of Community Medicine at Hamdard Institute of Medical Sciences and Research, New Delhi. I think when we speak about healthcare of any human being, irrespective of their identity or level of marginalization, it's quite the same for everyone. So just like any other people, trans people also need healthcare services in terms of immunization, in terms of treatment for common ailments like fever, diarrhea, etc. At the same time, because of their specific needs, because of their marginalizations, because of their lack of access to the healthcare, they also have certain special needs of healthcare. Like, for example, trans folks do need gender affirming surgeries that they may want to undergo to affirm the gender that they identify with rather than the sex which was assigned to them at birth. At the same time, we also know that because of so many stressors that trans people can have from their family, at workplace, in the society in general, a lot of mental stressors, and hence trans people are at a higher risk of mental illness, including suicidal ideation and doing suicide. In that case, then the mental health need of the trans people also increases. We also know that trans people can often lack access to simple healthcare services like for menstrual disorders, services like, for example, immunization against COVID-19 or preventive checkups for cancers, etc. Because when these policies have been made or when the healthcare delivery system has been made, it has not taken into consideration that the recipient of this healthcare service could also be a trans or an intersex person. So to give an example, if I speak about breast cancer screening through mammography, I'll only imagine women coming for it. Though we know that men also have breast cancer, but you hardly see any awareness or inclusion in the healthcare services for men to seek breast cancer screening. Similarly, when we imagine breast cancer screening, do we also consider trans people as going and taking those services? Can we have trans men seeking those services? Or for example, when we speak about the cervical cancer screening, which you generally think only women will have, but trans men can have cervix and they also need that screening. But unfortunately, that's not part of our imagination or design of the programs. So trans people have health needs just like anyone else, but at the same time, they also have specific health needs, and we also need to take into account the marginalization and the lack of access that they can have in the healthcare system. Fortunately, India is one of the countries that has a specific legislation for transgender persons. We have the Transgender Persons Protection of Rights Act 2019 that protects trans people against discrimination in the healthcare system, and that also guarantees provision of healthcare to trans people, not just in terms of general healthcare, but also in terms of gender affirming services, what is called as gender reassignment surgeries. It says that every district should have a hospital providing these services, every state should have the hospital providing these services. And also last year in September 2022, the government of India included trans people in Ayushman Bharat scheme by providing them with a card called Ayushman Bharat TG Plus card. That card entails them to avail of healthcare services up to 5 lakh rupees per annum, including gender affirming services. Now, why that's a very welcome move, the devil lies in the details, and the problem is how many trans people really have access to the card per se. And only those who have the trans ID, which very few, maybe less than 10% of trans persons have, can have access to the insurance card. And even when I have an access to the insurance card, the next question is, where do I avail those services? So for example, in a state like Delhi, we do not have a single government hospital providing these surgeries. And the private hospitals which do provide surgeries are not interested in empaneling with the Ayushman Bharat scheme because they already are much in demand. Therefore, the important aspect to consider while making policies is not just to have the intent right, but to also ensure that they benefit the recipients of these healthcare services. And therefore, it's very important that the public health institutions and government hospitals start providing not just general healthcare services, but also gender affirming services to trans people. And we also ensure that these health insurance schemes are actually workable and you have more private hospitals empaneling and providing services under the scheme. I think it's also important now that as we think of solutions for trans healthcare, is to think of trans people not just as people who receive services, but also people who provide services. And therefore, to really bring about an access to services, we have to ask, where are trans doctors? Where are trans nurses? Where are trans-friendly hospitals or trans-friendly health insurance schemes? Because until and unless you have an entire ecosystem where you have transgender healthcare providers, from doctors, nurses, technicians, to hospitals that are trans-friendly and include them, to healthcare policies and insurance policies that include them, only then can we really have an inclusive and accessible healthcare services for transgender persons.